And we are back here on the WHHI-TV Daily News. Joining me is Dr. Theresa Roman. She is the owner and psychologist with Balanced Wellness. Thank you for being here today. It's nice to meet you.
Thank you for having me.
Yeah, so we're wrapping up Mental Health Awareness Month,
Yes.
which May was and continues to be for another couple of days. But what you want to focus on talking about today is maternal mental
Yes.
health and maybe a little bit of paternal mental health, and something called perinatal mental health. And I think maybe it's a conversation that doesn't happen often enough. So let's talk a little bit about it.
Yeah, so perinatal mental health focuses on anything from pregnancy to up to 2 years postpartum and anything in between that. And so the focus on that is supporting mothers and fathers and family members who might be struggling with, we call them perinatal mood disorders or PMADs. And those include things like postpartum anxiety, postpartum depression, perinatal OCD, and then there are a few others, but those are the most common ones that we see.
Okay, and so if we are a father looking at a mother thinking maybe there's something not quite right going on there, or if we're a new mom and we're feeling like this isn't feeling like how I thought it was going to feel, what are some of the things we should be looking out for and when we should start having a conversation?
Yeah, so I think it's really normal when you're bringing a new baby into your home to worry about that and to wonder if things are normal. You're probably not sleeping enough, you're not feeding yourself like you did before the baby came, and you might notice that you're a little more irritable or anxious. So I think anytime is really a great time to come in and talk with someone about what you're experiencing, or a partner to say, hey, maybe we should go and talk with someone. I would say that, starting by asking yourself, do you feel like yourself? Do you feel like you're experiencing things that are maybe out of the usual for you? Do you feel a little more irritable, more anxious? Are you having racing thoughts? Are you finding it a little bit more difficult to get out of bed? Some moms also experience difficulty bonding with their baby, or maybe feeling like they're a little more disconnected from their family members. And so I think those are some things that probably would be helpful to come in and talk with someone.
Yeah, and of course, as a new mom, you also have hormones that are completely out of whack that are contributing to all of that. Excuse me. So talk to us a little bit about some of the resources that are out there and available to people that are having those issues, and really talk maybe a little bit about taking some of the stigma away, because I think new moms in particular think, oh my gosh, I need to know what I'm doing. I need to have this all under control, and I don't want to tell anybody that I'm not feeling like I have this under control.
Yeah, and I think the pressure of what you see on social media or what you think other people are doing and celebrities bouncing back or having things under control can be really intimidating for a new mom or a family. And so I do think that just slowing down, finding your resources, figuring out the first place that a lot of women go is to talk to their OBGYN or their family doctor. That person will hopefully direct you to some resources. You mentioned hormones, so it might be medication or it might be something more biological going on. Our clinic and other clinics like myself have spaces just for moms, and just to take that stigma away, giving you a cozy place to come and just to talk with someone and to see if there's something bigger going on.
And talk to us a little bit though about, because you did mention paternal mental health also.
Yes.
Talk to us, I really, talk about something that's not talked about. Tell us a little bit about what might be happening there with new dads.
Yeah. So 1 in 5 moms experience a PMAD, a perinatal mood disorder, and then 1 in 10 dads is also likely to experience that as well. Okay. It goes up to 50% of dads who have a struggling partner will be most likely to experience a PMAD themselves. Okay. And so you might have a dad who's experiencing depression, anxiety also.
Very interesting. So tell us a little bit about your practice, where we can find you, and again, some of the things that you offer.
Yeah, so Balanced Wellness is a clinic. It's right here in Bluffton, but we can serve across South Carolina, so it's really nice for moms who have new babies at home and they rather have virtual care or they're somewhere else in the state. Yeah. And we provide individual therapy, group therapy, and family therapy. We've actually opened it up because we noticed that moms who have family members who are struggling, like the dads or maybe their other children, so we've opened that also up to their family members to kind of extend the care throughout the practice and their family.
Love that. And so if somebody needed care beyond what you can offer, then you also have resources to guide them to where that might be.
Yeah, so I wanted to mention Postpartum Support International, PSI, has a really great website. It has a screening tool where if you think you might be struggling, you can fill out some of the questions on there. They have support groups that are online on there as well. They also have a directory, a list of other providers. Maybe you're not in South Carolina or you're traveling. They have a list there. And then MUSC has a really great reproductive health program as well for other women who might have other needs too.
Well, I love love that online that you talked about, because I think maybe that's like maybe a less intimidating step to take first. So that's a great resource.
Yes.
Theresa, thank you for being here with us.
Yes.
We really appreciate it. What a great topic to be highlighting for Mental Awareness Month. Thank you so
Yes.
much.
Thank you.
And we'll be back in just a moment, so don't go away.